Hey everyone, it is Professor Lee here with your Chapter 5 Dosage Calculations quick lecture. So some things that you need to know about adult dosage calculations. We begin with the average adult dose. So the average adult dose for medication is going to be based on a person between the ages of 20 and 60 years old, and with a person that has an average weight of 150 pounds. So obviously, if the person is younger than 20, older than 60, or is well outside of that 150-pound range, then some adjustments to the dosage will need to be made. Weight and volume. The weight of a medication can be expressed as milliequivalents, micrograms, milligrams, or grams. Volume of a medication can be expressed as milliliters, ounces, teaspoons, tablespoons, and then there's a bunch of other household household measurements like cups, quarts, liters, gallons. Um, liters actually isn't household, that's metric, but gallons, quarts, cups. And over here on oral versus parenteral routes, the oral route is given by mouth. The abbreviation for by mouth is PO. This is most commonly used because it is the safest, most convenient, and also the most affordable means to administer medications. However, we do have the alternate route, which is parenteral, and that is any route that is not enteral. So if you break down your med term, par plus enteral, that would be not enteral. And so that means that it's going to be given outside of the alimentary canal, and this happens most often via injection. Now, there are some other means to introduce a medication to the body other than injection. So you can check out more information on that in your textbook. But as far as injections go, I've drawn a little diagram here where you can see the different layers of muscle that the injections go into. So the subcutaneous layer goes into the adipose tissue that is also known as the hypodermis. And so here, hypodermis. And the intramuscular does exactly what it says. It goes into the muscle. The intradermal goes into the epidermis up here, which is the top layer of skin. And then intravenous goes into the vein. So it doesn't go into the skin, it goes actually into the vein. All right, so dosage calculations. We have a formula, and there are a couple of different ways that you can calculate dosages, but as I had mentioned previously, we're only going to focus on one for this course, and that formula is D over H times Q. D is your desired, which is what has been ordered. The H is what is on hand, and then the Q is the quantity. So I'm going to give you a little bit of a tip here for quantity. If it is a solid medication, so a tablet, a capsule, anything like that, the quantity will always be 1. If it is a liquid medication, so something that you're going to calculate out in milliliters, the quantity is 1 unless it is otherwise specified. So if it says 250 milligrams per 5 mils, then the quantity would be 5. If it just says 250 milligrams per mil, then the quantity would be 1 mil. So that's what your quantity is. Steps for calculating the dosage. First, you're going to convert any terms necessary to make sure that you get like terms. And so we want to always have the same terms here and here. My highlighter is really big, dang. Hold on. So milligrams and milligrams. So these terms, whatever you have, your desired dose and your on-hand dose, those need to match. And then you're going to divide. So in this case, we're going to divide 250 by 500. And for this problem, it says our quantity is per 5 mil. Let me get a different highlighter here. So 5 mil is our quantity there. So to do the math here, we're going to do 250 divided by 500, and that's going to give you 0.5. So 0.5, and then we take 0.5 times 5 is going to give you 2.5. And then you need to remember to always, always, always make sure you label your quantity or your dose with the appropriate label. So in this case, the problem works out to be 2.5 mils. All right, let me get rid of all of this. Okay, down here, pediatric dosages by weight. So some drugs for children are dosed according to body weight, and that could be milligrams, kilograms, or by body surface area. The calculations for body surface area are kind of convoluted and confusing. So for this course, we're just going to work through how to calculate them by body weight. So the steps for weight calculations, what you need to know is that you're going to need to convert pounds to kilograms, and 1 pound is the equivalent of, 1 kilogram is the equivalent of 2.2 pounds. You can see that down there. And you want to multiply the dose ordered by kilograms. So I have an example worked out for you over here. For example, the child weighs 50 pounds and amoxil is ordered as 10 milligrams per kilogram every 8 hours. And so this is what this reads, 10 milligrams per kilogram every 8 hours, okay? So the first step is to divide 50, which is the child's weight in pounds, by 2.2, which is the equivalent of kilograms to pounds. And that's going to give us 22.73 kilograms. The next step is to figure out what the dosage per dose is going to be. And so, or the amount per dose is going to be. So we're going to do 22.73 times 10 milligrams because we have 10 milligrams up here, right? And that's going to give us 227 milligrams per dose. Oh, I said that backwards, guys. That's going to give us 227 milligrams per 24 hours. That's what it is. And then the next step is to divide that by 3 because we are doing every 8 hours here. And so this dose needs to, or 227 needs to be divided by 3 because 24 divided by 3 is 8. So you would dose this out to this kid every 8 hours. And that would be 3 times in a 24-hour period. So 227 divided by 3 is going to be 75.5 milligrams per dose. Okay, so let me get rid of all this stuff down here because otherwise I'm going to upload this for you and it'll have a whole bunch of notes on it. Okay, on the next page we have some other things that you need to be aware of. First of all, when you're rounding equations, if you are doing a dosage calculations with a liquid, you want to round to the nearest tenth when giving more than 1 mil. You want to round to the nearest hundredth when giving less than 1 mil. You always round down for a number that is 1 through 4, and you round up for numbers 5 through 9. So say you have 1.642 is what your calculation ends up being. You are going to, if it's more than 1, you're going to round to the nearest tenth, and the 10th position is here. And so 4 is the position that you would look at to round. 4 is less than 5. 1 through 4, you're going to round down. So you would end up with just 1.6 mil. Now, say that this was 1.672 mil, right? Again, it's over 1, so we're looking at the 10th position here. But this number in the 100th position is over 4. It's 5 or higher. And so we are going to round up. So the answer for this rounding would be 1.7 mil. So hopefully that makes sense. And for numbers less than 1, it works the same. except for you go to the 100th position. So if we did I'm trying to find a blank space here that's easier to write on. So if we did 0.417 and we did 0.487, you're going to round to the nearest hundredth. Let me change this. Okay, so 0.417, 0.481, okay? So we're going to round to the nearest hundredth, and in this case, this is the, oh, shoot, I almost said a bad word, sorry. This is the 100th position in both of these, and so we are going to be looking at the thousandths position to know if we have to round up or down. So in this case, the 7 is above a 5, so we are going to round up, making this 0.48. And in this case, the 1 is below 5, and so that would make this 0.48. So you get the same answer with both of these, but it really depends on what is in this 100th position in order to round for both of those. All right, so that's basic rounding information. Let me get rid of that. For solids, when tablets are not scored, so I drew a little picture here to show you what a scored tablet looks like. I'm sure you've seen this in real life, probably a bunch of times. But sometimes tablets are scored into, let me find my, oops, sorry about that. Sometimes tablets are scored into fours or quarters, and sometimes they are scored in halves. And so if you can break it evenly in half, then it's scored in half. If you can break it into 4 parts, then it's scored into quarters. Usually to break a tablet into quarters, you're going to end up needing a pill cutter, even with scored lines, because it's very hard to get an equal dose, a perfectly equal dose, just snapping it along those scored lines. So with solids, if tablets are not scored, then you have to round to the nearest whole number of what is available. If it's not scored, you cannot give a half a tablet or a half of a dose. If the tablets are scored or capsules are scored, then you want to round to the nearest whole or half units, tablet, capsule, whatever. Capsules are those medications that you can pull apart and they have all of the things inside of them, like all the grains and medicine inside of them. Capsules can never, ever, ever be broken in half because the medication is set to dissolve inside that gel cap. And so you have to always use a whole capsule. So if your calculation calls for 2.5 capsules, then it's going to be 3 capsules. So you want to make sure that you know not to ever break a capsule in half. But tablets and what is the other one? There's another one that's scored and I can't think of it at the moment. Anyway, tablets can be broken if they are scored. If they are not scored, they cannot be broken. You always want to wait until the very last step. This is important down here. You want to wait until the very last step of dosage calculations to round your answer. So make sure you remember that. And moving on over here, we have other things that you should know. So when you are considering how to calculate dosages, you should remember that gender can influence medications. Many medications are contraindicated during pregnancy. There are also other factors that can influence medications, such as the physical and emotional state, disease processes, having multiple diseases, the infection or causative microorganisms, medical history and allergies, the safeness of a drug, and then also the desired max results. So we, for our program, cover medication administration and Medic 208, but there are a few reminders that I feel are worthy of sharing here in pharmacology and dosage calculations as well. First, you want to only give meds that you have prepared. You should never, ever administer medication that somebody else has prepared. You do not ever allow others to give meds that you have prepared. You never, ever, ever leave medication unattended, because if you do, even if you turn your back on it for a second, you can no longer testify in court that you had complete control of that medication at all times. Never give medications if there's a question about the order. Always go find the physician or the prescribing provider and clarify. You want to make sure you know the facts about the drug that you are administering, so potential adverse effects or side effects, because you need to be able to look out for those and also educate your patient. You want to double check the expiration date. You want to never administer a medication that looks unusual. If it looks weird, especially if it's something like insulin, if it looks weird, don't give it. Just make sure you do your due diligence and double check, triple check, ask the provider. And if your gut tells you something isn't right, it probably isn't right. So don't give a medication that looks weird. Documentation is paramount. If you don't document, it did not happen. So you need to make sure that you document the dose, the route, the site, and the time given every single time. Medication errors should never ever happen if you follow the 7 rights. So again, we cover the 7 rights extensively in Medic 208, but if you follow those 7 rights, then you should not commit a medication error. And medication errors are dangerous. They are dangerous to your career, and they, more importantly, are dangerous to a patient. It can be life-ending if it's severe enough. So you just want to make sure that you're always doing what you can to take care of business and do things the right way. Medications that are ordered in units is the last section for this chapter, and things you need to know here is that some medications are ordered in units instead of milligrams. This is commonly seen in insulin. Insulin is always dosed in units. Unit medications are standardized based on their strength, and the strength varies depending on the source, the condition, and the method by which the medication was obtained. Unit dosages are calculated just the same as any other. It's just the label, the quantity is going to be units instead of milliliters or capsules or tablets. So if you see a U in there, don't get confused. It's just units. It's just another quantity. A couple of other things, like I said, insulin's always dosed in units only, and there are always 100 units in 1 milliliter. So that's a good quick tip to remember, is that there are always 100 units in 1 milliliter. So just keep that in mind. All right, so I think that's it for chapter 5. If you have any questions, let me know.